Hello, my name is Laszlo Karai. I'm the Program Director of the Surgical Critical Care Fellowship at OHSU. I'd like to welcome you to the application process. I prepared this video to provide you some important information about the fellowship ahead of your interview. Your curriculum at OHSU consists of a very customizable rotation selection. During your year at OHSU, you will participate on the trauma surgical ICU service for 6 months, and then about 6 months at the Portland VA surgical ICU. You then have four-week elective blocks. We must adhere to the surgical critical care program requirements, which state that at least 10 months must be dedicated to the care of ICU patients, and then no more than 2 months must be spent on a non-surgical ICU. Here's a sample schedule of a fellow at OHSU. As you can see, they're spending 6 months in the trauma surgical ICU. However, they've also elected to spend time on the anesthesia service for an airway experience, the cardiovascular ICU, the EMS ultrasound experience with our emergency department, and the nephrology rotation focusing on ICU renal care. OHSU has robust facilities, all contained on Markham Hill, which is the site of our main campus. And so the Portland VA, the OHSU main hospital, the Shriners Hospital, and the Children's Hospital are all on campus, connected by various routes and sky bridges. Relatively new on campus is the Portland Aerial Tram. This tram connects our main campus to the South Waterfront campus, which includes outpatient and outpatient operative facilities, simulation center, as well as the medical school. There's also opportunities for living, including apartments and condos that former trainees have taken advantage of during their year of fellowship. Here's an overhead map of the flow of trauma care at OHSU. So as you can see, the trauma bays are located in the ED. Patients are typically received by ground in that area. If they're received by air, they take elevators from the roof down to this area. From there, patients can either go 2 floors down to the operating room through the same elevators, or they can go to our CAT scanner and ICU, which are on the same floor. The fellows' offices are currently just 1 floor below in a private room, so that is very nearby, which is convenient for fellows to make it up to the ICU or trauma from their offices if they need to get administrative tasks accomplished. In our emergency department, we participate in multi-professional care, so we handle emergency activations with the emergency room and anesthesia staff. So for modified activations, the ER staff and resident, trauma nurses, and the trauma chief resident are there. For full activations, we add a respiratory therapist, attending trauma surgeon, and attending anesthesiologist. Our intensive care unit has been recently redesigned for larger rooms and more capable spaces. Our ICU features a central resuscitation bay with overhead lights, allowing us to perform more complex procedures and even operations. Next, we'll go into the actual core curriculum in the surgical ICU and team makeup. For our home rotation, the trauma surgical ICU, we divide that into weekday and weekend rotations for coverage. On the weekday portion of your year, you will spend Thursday nights acting as the trauma chief, providing surgical coverage during the day and night for 24 hours. You will also cover the trauma chief during certain vacation weeks. These opportunities are important as they provide an operative experience and allow you to integrate within the trauma team. The trauma surgical ICU weekday rotation has you provide daytime coverage on Monday and Tuesday, Wednesday with continuity. And again, Thursday you become the trauma chief and then spend a 24-hour rotation in-house. And then Friday morning you would sign out. And then you have the weekend off before returning on Monday. Our weekend rotation is essentially the opposite of the weekday rotation, where you provide continuity and ICU coverage from Thursday to Sunday, leading the team. On Wednesday, you serve as a backup role, which lets you focus on educational efforts. On Monday, a relatively new addition is having the weekend fellow cover operative trauma and emergency general surgery cases while the residents are at their mandatory educational conferences. This provides an important, consistent operative experience during the fellowship. The trauma surgical ICU team is multidisciplinary. A typical team consists of an attending physician, a fellow, 1 to 3 advanced practice providers, 1 to 2 residents, and 1 to 2 interns, as well as medical students. We do utilize a multi-professional staff to try to provide optimal patient care. And so on a typical daily basis, you'll be interacting with nurses, pharmacists who are actually on rounds, social workers, case management, physical therapists, physiatrists, and the dietitian team. We have structured this fellowship to allow flexibility, and this allows you to focus on clinical endeavors, but also equally important educational and personal development efforts. The schedule allows fellow coverage, so we can flex and cover each other, so you can attend meetings, you can attend interviews with great flexibility. The Wednesday backup fellow, as I mentioned, allows a focus on team ICU education. At OHSU, fellows all participate in a fairly robust operative experience. So fellows, when they do rotate in their trauma role, are given greater operative autonomy when they cover those operative traumas and operative emergency general surgery cases. Here's a photo of one of our current fellows taking a junior resident through a neck exploration for a gunshot wound. As I mentioned before, the weekend fellow also covers EGS cases on Monday mornings while the residents are in conference, also leading to a consistent operative experience. This past year, residents also have all had moonlighting opportunities covering acute care surgery at area hospitals, leading to further autonomous operative experiences. I want to go through some of the elective choices. Echocardiography is typically a several week rotation focusing on just performance and interpretation of echocardiograms, which is very helpful at the bedside in the ICU. We have a pre-hospital EMS rotation that allows you to do some ride-alongs and attend trauma system meetings. We have our cardiovascular surgical ICU, which takes care of our more complex cardiac and thoracic and vascular patients. Our ECMO rotation involves a multidisciplinary group providing ECMO care throughout the hospital. And then we also have popular pediatric ICU and medical ICU rotations. We do offer the ATLS course in the event that you've lapsed your coverage. If you're not an instructor already, we do offer an instructor course. And so you have an opportunity to be certified with an instructor during your year of fellowship if you're not yet certified. Starting in 2022, we started offering the Definitive Surgical Trauma Care course. And so this is offered to fellows annually. It's one of the first deployments of this course in the nation. And it's a course that focuses on trauma surgery and the decision making. And it's done through group discussions, an operative course with the animal lab, and then an exposure course with a cadaver lab. There's a focus on multi-professional communication. And again, by taking this course, you have an opportunity to become an instructor in the DSTC program. We do fund you for travel to a national meeting during the year. Some fellows have inquired about taking a course in lieu of travel to a meeting, and we are flexible with that arrangement as well. The OHSU Division of Trauma has a large faculty with many diverse backgrounds. This impressive roster will ensure that you can find a faculty member with your particular research or professional interests. For fellows, this guarantees a robust mentorship experience. The next few slides will just go over some of our faculty here at OHSU. OHSU participates in the AMC Triple T program, which is a military civilian partnership. And so a team of multi-professional Army personnel deploys at OHSU, including 1 to 2 trauma surgeons, a trauma nurse, ICU nurse, and a CRNA. The trauma surgeons in this program serve as surgical critical care faculty. This has been a welcome benefit to the fellowship as it adds multiple new faculty members with different perspectives and experience, which has been a boon to fellowship education. Our trauma research program has obtained over $30 million of funding in the past 15 years. The Trauma Lab has weekly research meetings that the fellows are invited to. And with these meetings, you can discuss and develop projects, obtain resources, participate in ongoing studies, and then practice presentations for meetings you'll be invited to. The fellowship has numerous educational opportunities. Some of these include weekly multidisciplinary critical care lectures. On Wednesdays, we alternate between Trauma EGS Conference presented by the residents and commented on by the faculty, and then Trauma Journal Club. During the Journal Club, fellows select 3 articles that are presented by students and residents. The fellows lead the discussion along with the faculty. This process allows a self-guided mastery of the literature over the year. The VA rotation itself has weekly meetings and conferences. And then we've also included monthly attending small group format fellow conferences where attendings talk about typically their clinical or research focus. We also subscribe to the SCORE Surgical Critical Care Curriculum, which provides longitudinal curriculum as you prepare for your critical care boards. There are also numerous administrative opportunities for you as a fellow. And so we do have you participate in both the Wednesday weekly division M&M as well as a monthly ICU M&M. There's a trauma committee where we get to focus on program improvement and implementing new quality efforts. We have a peer review meeting as well that'll be part of your fellowship. And then you'll have the opportunity to participate in various quality improvement committees and then regional trauma advisory boards, which lets you focus on trauma at a system level. We do ask that you complete a QI project. Typically, these are something that come up as a clinical need, and then they are presented for approval at the trauma committee level. And so it typically involves the evidence-based clarification of a guideline or a procedure. This always has the opportunity for scholarship if you look at outcomes and implementation. We also have the fellows participate in an end-of-year fellow debate, which is a two-on-two format, focusing on a current controversy in acute care surgery. We have had an excellent track record of fellow graduation and placement to a diverse group of institutions. Over the next few slides, I'm just going to list the destinations of our graduates over the past 12 or 13 years. Some of the recent years here. All in all, on the graduates that I demonstrated, the breakdown is about 48% go into academic careers, 45% go into private practice, and 7% continue on their military careers. Some changes that we have had recently is that we've been refocusing our evaluation system to provide more timely, frequent feedback. We have been experimenting with an ICU triage rotation where you serve as a resource throughout the hospital to look at ICU transfers, perform procedures with a fair degree of autonomy, which has been popular. And then on Mondays, we do offer you some acute care surgery coverage to expand your operative opportunities. We've also been expanding our conferences with a trauma radiology conference, focusing on interesting cases from both a trauma perspective and a radiologic finding perspective. And then we've been altering our lecture schedule to make sure that more fellows can attend. And so all these changes are geared towards gradual improvement and and a benefit to your educational experience here. Oregon is a great place to live. I've been here for over 2 decades now, but there's always really cool things to find in the city and in nature. There's no lack of cultural events to attend, and so it is a great place for you to spend time during your fellowship. To summarize, we offer a highly flexible program at OHSU. This program can be customized to your specific needs. We also offer a robust research environment that allows you to be productive during your fellowship. We also have high levels of resources and a high patient care volume. These patients are not only complex trauma patients, but also complex surgical patients. All in all, we have an excellent placement history, as you can see. We very much look forward to having you here soon. We will have a lot of time to answer questions during your interview day, and I very much look forward to meeting all of you. Please take notes, and we can get all of your questions answered that day, and hopefully I'll see you soon. Thank you.